In this video series, 3D MedNet is with 3D Life Prints at Alder Children's Hospital in Liverpool. We're talking to surgeons about how 3D printing helps them solve the most difficult of cases. In this second video with Mike Richard, Head of Engineering at 3D Life Prints, Mike discusses what filament is best for which application.
Depending on what the model is intended to be used for, here in the medical field in the UK, we have kind of defined three categories with which the models are used for. The first is for doctor-patient communications. So this can be a very basic, often single color model, which would purely be used in the doctor communicating with the patients, and in the case of pediatric medicine, the patient and their parents. This can be very useful in educating them as to the procedures they plan to undertake. It can be very useful in helping the patients understand their conditions more fully. The second major use for 3D printed models would be for education. So this can be, it's obviously a massive field, this can be the next generation of doctors and surgeons that are coming through the ranks. These educational models can be as basic as anatomy models, just showing different pathologies for the different surgical fields, or they can be as advanced as specific surgical simulation models where you can teach and enact a specific surgical procedure on a 3D printed model. So in this case, you'd be looking to match materials with specific tissue densities and tissue properties. So in the medical teaching field and in the third field, which would be for the preoperative assessment and planning, you would really be working with a whole range of materials that would best suit its individual purpose. For soft tissue, we often look towards more flexible materials. These can be thermoplastic polyurethanes. On the lower end of the FDM printing scale, this can be materials like Filaflex, which when printed thin enough can mimic or semi-mimic softer tissues within the body. Going up more advanced, we would then look towards some polyjet materials like the Tango range, where we can again mimic certain softness densities. However, with the up-and-coming silicon printing technology that is more and more coming into the scene, we can really look to these to mimic a whole range of soft tissues in the body, building up very realistic cardiac and renal models, which can be accurately cut and sutured, and all sorts of specific procedures can be actually practiced on them due to their real likeness to actual soft tissue in the body. For bones, we can look again on the lower end of the printing scale towards things like wood fill, because wood fill can actually, when printed under the correct settings, get quite close to mimicking bone and how it reacts under a saw or a drill. On the higher end of the scale, we can look to some of the SLS powders, such as nylon. So this comes right at the start of when you're creating a 3D model, when you define what its purpose is. If you're looking for something purely visual, you'd maybe look for a lower cost FDM material. If you need to match the specific densities of tissue, you would then go with the polyjet technology, proprietary silicon printer, or with some of the SLS machines. So you really, at the start of each project, you need to identify what the model will be used for to then figure out which route you're going to go down in terms of 3D printing.
Thanks for watching. If you enjoyed this video, make sure to check out the rest of the videos in our series from Alder Children's Hospital. Make sure to like and subscribe on Facebook so you don't miss the latest videos from 3D MedNet.